Welcome to another episode of Pretend I Don't Know Anything. Today we're with Grant Young, Director of Admissions. Quite an extensive resume working in the substance use and mental health field. And we're going to be talking about different levels of care, defining, understanding the different levels of care. And really what I feel is very important in this, Grant, is that people understand what designates quality care and treatment, and what they should be looking out for in finding quality treatment for their loved one as well. For many of us, like myself included, coming into recovery, an intervention is where I started, right? It was where my family started. So bringing on an interventionist to perform the intervention with my family and get me into treatment and the help that I needed.
Sure.
But I know, working in this field for a long time, it's not always necessary that an interventionist has to be involved.
Yeah.
And my question to you is, in your experience, when do you see that that's necessary, and what would a family be looking for to kind of decide, okay, I need this additional help in this area, or we can move forward on our own in it?
Sure. I would say that in most cases, like 99%, I would usually recommend getting an interventionist involved. I think what's important, a question is, when is it necessary, but also, is it obtainable, which is the reality. Most interventionists cost money outside of insurance or, your premiums and things of that nature. But if the question is that it is obtainable, I would say the reason why I think that interventionists are important is because this is an individual that they are not emotionally tied quite like mom or dad or aunt and uncle or brother, sister, or husband, wife.
Yeah.
Most of the time, at least in my experience, when working with families, is there's been enabling happening for years. Mm-hmm. This isn't something that started last week. Mm-hmm. So to break these habits of years long of forming those habits, to break those is really difficult to do on your own. It's similar for me. I wasn't able to get sober on my own. I had to have some help. And in order for me to get started, my story is not necessarily an intervention happening, but my mother having outside perspectives and outside help, working with her to set boundaries for me to be in a position to be able to accept the help, if that makes any sense.
Yeah, absolutely. And I think that's the thing, right? Like, I would say that the line is how comfortable are you as the family member in holding that boundary on your own, and how confident are you in your ability to hold that boundary and not cave?
Yep.
Because one of the worst things we can do is set the boundary and then not hold a boundary.
Yeah.
Well, what we're showing others is that the boundary doesn't matter. Right? That they don't have to respect my boundaries. And I think that goes for anything, not just interventions, right? Like if I tell somebody, hey, don't poke me in the chest, it bothers me, and then they poke me in the chest and I don't say anything about it, then I'm just showing them that my boundary doesn't matter, right? And so then why would they respect that with that boundary or any other boundary, right?
Sure.
And
the boundaries can change depending on the family.
Yes.
I think in this industry we jump to, you have to kick them out.
Yeah.
They have to be homeless. Not the case for a lot of people. How old is he? How long have we been going through this? Where is he at in his life? Do we even have any leverage besides emotional? Is he taking care of himself? So all of those boundaries, I think interventionists do a really good job. Not all interventionists, right? Not all treatment is good treatment, right?
Yeah.
Not just in this industry, but in generally speaking.
Well, not all roofing companies
right.
a great roofing
Exactly.
company, right? Yeah,
so
it doesn't matter.
Good interventionists, in my simplest form, number one, can help determine what appropriate boundaries to even begin with, but then also following through with those boundaries. And we've heard a lot of really good interventionists say, do not set a boundary you're not willing to follow through with.
Yeah.
If you do X, Y, and Z, you're out of the house. And if he stays in your house, or she stays in your house, that's not a good start. But I tell families when it comes to, talking about interventionists and how this all works and everything, it's easy. It's kind of like a financial budget. Mm-hmm. It's really easy to make one.
Yeah.
I can make you a spreadsheet. It looks really good. This is how much we budget for groceries. This is how much we budget for out to eat. It is near impossible to follow it.
Yeah.
It's really difficult to follow it. I know this from my own personal experience. I have an Excel sheet. It looks really good. But following it's another story. It's the same thing with setting boundaries with our loved one. Mm-hmm. So when we are on the phone with a guy like me or a guy like you or whoever, and we're talking about hypotheticals, it can be really difficult when you get into that room when you're not with somebody who's a trained professional who's been doing this for a long time, to not be able to help guide you there, because you're gonna need a spotter, if you will, like in the weight room. You're gonna need somebody to help you with that last rep, which is the most important rep. I would say that a line that I use a lot with families is, I have a lot of moms in particular tell me I can't imagine putting my son on the street. Mm-hmm. And I tell families a lot of times, you're not necessarily putting him on the street. He just doesn't agree with the address.
Yeah.
It's not home anymore. It's not that apartment anymore. It's not that girlfriend's house. It's not that whatever bridge anymore.
Yeah.
They just don't agree with the address.
Yeah.
That was what happened to me. Mm-hmm. I didn't agree with the address for I don't know, 5-6 months.
Yeah.
But anyways.
Yeah. No, I agree. I feel a lot of times families or even professionals just undervalue the emotional leverage, right? We tend to really stick on, is there financial leverage or the address, right?
Yeah.
Like the superficial circumstances, right? Mm-hmm. And altering those, when I feel a lot of the time the emotional boundary and the emotional leverage is actually stronger than a lot of the other
money or
apartment or car or bedroom, leverage.
That was my experience.
Yeah, me too.
I had some, I had home issues. I had money issues, of course.
Yeah. I
would say the emotional leverage really came into when I began treatment, which we'll get into in another segment. But, the intervention process at the beginning to get their loved one to go to treatment, it's that same intervention style was happening to me throughout my entirety of treatment.
Yeah.
Which we won't get into right now as far as the continuation.
Yes.
I went to a lot of treatment. I didn't, I didn't just have an intervention or something like that,
Yeah, it's not just the initial intervention. That's to get started. So then, we've done this for a while, you and I. There's nearly 30 years experience between the two of us in this. And like we've already established, like with anything, there's good hospitals, there's bad hospitals, good doctors, there's bad doctors, good car dealerships and bad car dealerships. The same thing with treatment or professionals in any sort. Because I know you do refer out to interventionists, right? When families are calling and it's clear, okay, an intervention is needed in this, so these are some people I think you should call. Here's this group of people. Yep. What is it that you're looking for in those individuals that you would say this is why you refer to them, why you consider them to be quality interventionists?
It's a good question. I think in my experience, this is going to sound a little silly, I think, but it's not just do they pick up the phone, but do they communicate well with me as far as each step of the way on where they're at in their process. Mm-hmm. I think an interventionist's role, and again, I'm not an interventionist, but the ones that I have worked with that do really good work, they continue to keep the family in the loop and the treatment centers and where they're going type deal, or where they could potentially be going, in the loop. Mm-hmm. This isn't something where you hire a hired gun and then you take your hands completely off. Yeah. The family, the treatment centers, there's a lot of people at play. Good interventionists communicate to those parties and keep everything organized as best as they can. This is a volatile situation. This isn't usually controlled. It's tough to control, I should say. I would say that interventionists, very similar to like someone who I believe would be good at admissions, is a really good listener. and just understanding where this family and where this individual is coming from and their situation. We talked a little bit earlier about each boundary is unique and each boundary is special depending on the family. Intervention is not a blueprint that you're following each and every time. You've held intervention, and I mean, they're all different. You could take a 21-year-old heroin addict and a mom and dad who are still married and a bunch of things that are the same. It will be a different scenario each time you walk into those. So in my opinion, good interventionists are the ones that I like to work with, that we like to work with. They communicate properly, and they listen and want to understand the full story about what's actually going on. Because the intervention part of actually getting into a room, right, what you see on TV is not always the case.
Yeah.
But also determining where the appropriate place to go, because you're gathering data, understanding the family and the individual and the uniqueness, not only to just to create the appropriate boundaries for that unique case, and not only to hold those boundaries in a unique way, but to also find the appropriate level of care, which we'll get into in a little bit. But where are we going?
Yeah.
Because just like interventionists are not all the same, treatment centers aren't all the same.
Yeah.
And so if I had to sum it up into like two reasons, I'd just to say proper communication, they're organized, and they listen.
Yeah.
It's not pay me this amount of money and we're going to hardball it type deal. I mean, sometimes that's not always the place,
No, I agree. They're able to utilize different methodology depending on the situation, what's going on.
Yeah.
My experience and what I would deem generally interventions that I want to work with are individuals that aren't just like, you pay me, I do the setup for this, we do the intervention, and if it's not successful, I walk away.
That's right.
I tend to want to work with interventionists that are going to continue on in the process, even if the initial approach is not successful.
Right.
Right.
Right. That's the story of mine.
Yeah.
I had a conversation. This is what you need to do.
Yeah.
And I said no. I used some different language, but I said no, thank you. And for 6 months, my mom was in contact with a couple different people in order to plan out what those because my mom started working her recovery program when I said no.
Yeah.
I wasn't, but there were a whole list of things that she needed to do, like continue holding the boundaries. What if he says no? What if he walks out? What if he grabs his car keys? What are we going to do with the apartment if he says no? What are we going to do with the dog and the 7 cats? What are we going to do with – there's a lot of scenarios. It's real easy, Mike, if I sat down with you and said, you need to go to treatment, and you were like, great, let's do it.
Yeah.
That's
actually is what happened to me.
Oh, really? Okay.
Yeah.
No, that doesn't always happen.
They sat down and they were like, hey, we don't know what you're doing, but we found all this, right?
Right.
And I go, yeah, this is what I'm doing. And like, if you can help me, then help me.
Right.
Right. I've run through all of my options.
Right.
But that was, excuse me, I think that was also a tricky situation to be in. Whereas, so I was able to, I went on for a long time, So like I was able to really hit this bottom after bottom after bottom before help was even offered. Right. So I had the opportunity to run through all of my own ideas of what could be successful before a solution was really brought to me. And I had to do it because honestly, there was no leverage for me really in any way. There was no intervention would have been successful prior to that. Right. For me, I mean, I had courts try to intervene on me and it didn't work, So I had to kind of go through that process to get there and to just throw up my hands, So yeah, that was my. Yeah. I think my family was anticipating this big
blowout.
Yeah, like we don't know how he's going to react, which I can't blame him for. I was very unstable, right?
Right.
So they had no idea how I was going to react to all of it. And I'm sure it was terrifying for them. And I'm really grateful that the interventionist was there to support them in it.
Yeah.
Because it was all unknown for them, right? And so that he was there to support my siblings in that intervention, I'm so grateful for. Nobody knew that it was going to be that simple.
Yeah.
Right.
Well, they most of the time don't go down like that.
They don't go down like that. Yeah.
I would say that I know maybe this wasn't the question, but when does an intervention need to maybe start taking place? Mm-hmm. When you determine that there's a problem.
Yeah.
It's not. If we were to take a starting point right from here, where we've recognized that there's a problem, and then we take another, we draw a line and we put another point here that says got sober.
Yeah.
This isn't a holding pattern, just waiting around. That wasn't the case for me, right? So my recovery may have started right here. My mother began the process unknowingly on my end, by the way, because I'm just getting high. I'm not thinking about it. I'm selfish. I'm self-centered. I'm running amok. But when my mom determined that there was an issue and began working on the process of getting me to here, she had a lot of work to do. Hang up the phone, turn off the car, right?
Yeah.
Don't pay for the apartment. There was a whole bunch of things that happened until I got to a point of I got sober, which is where whenever I tell my story, that's where this starts. But my mom could go back further and say, well, I've recognized there's a problem and I need to do something about it. Maybe Grant hasn't begun working his recovery, but there are steps to be taken in order for that process to even get started. And that's where a good interventionist comes into play, is to be able to determine what are those steps and what timeline, and be a continuation of help. Not just we're going to get into a room on the second, you're going to take out your letters and read out your letters, and if he says no or yes, my payment is due, and that's that. Yeah. The conversation, what we see on TV, the intervention, is a very small part of the recovery process.
Absolutely.
In my opinion.
There's a lot of prep and work that should go in on the front
end.
And I'm not saying, even if the result is not the result we all would want to see on that intervention, doesn't mean that the intervention itself is a complete failure.
Right.
And also doesn't mean that individual should not be compensated for their time and effort into it.
Of course.
Right. And I think for everybody out there is really investigating, talking to other professionals, therapists, psychiatrists, if they're involved, making those phone calls and getting feedback, doing some research on your own and kind of understanding what's best. Though, if you feel like you're in that moment, there is a window. And like I said, I did just say that none of those times would have been successful for me, but that's not absolutely true. There were multiple times in that long journey where if people would have known, right, because I was so separated from my family for so long, but if people would have known and had that insight that if it would have been offered to me in these brief windows of willingness, it would have been successful too.
Sure.
Right? But those windows were brief.
Yeah.
They would open and close very quickly. But there is help out there for you. And if you're in these stages where you're going, okay, we think we need help and we need to figure out what that looks like, starting with an interventionist is a good place to start. Most of the time it's needed.
Even having a conversation and a Q&A session. Mm-hmm. I mean, how many people who call, us and don't come to us, but they gain some type of knowledge and insight about what we would do or what we would recommend. It's the same thing with an interventionist.
Yeah, absolutely. Absolutely.
Because it's not always obtainable.
Reach out, get some advice, get some help. It is available to you.
Yeah.
Oh, thanks for another episode of Pretend I Don't Know Anything with Director of Admissions, Grant Young.